Hey, one of the most common calls that we get in the office for pregnant patients is for what we call syncope, or in some cases near syncope. Syncope is the medical term for fainting. Near syncope would just be almost fainting. And that is something we just get asked over and over and over again. And so just want to go over a few things. So number one, fainting and pre-fainting are super common for pregnancy. I'll tell patients that fainting or feeling like you're going to faint in and of itself is not necessarily bad. However, if you don't heed those warnings and you fall and have trauma to your own self or to the baby, certainly if you're driving and you don't heed those warnings, things can go bad. There are some medical things that can cause syncope. However, during pregnancy, it's almost always a blood flow issue. The womb, the uterus, puts pressure in the pelvis. It blocks the blood from returning promptly from the lower extremities back to the heart and then to the brain. And so the brain's sensing some low blood pressure. And that can be sensed as tingling in the lips, ringing in the ears, seeing flashes of light, feeling clammy, feeling a lump in your throat, feeling super, dizzy, or having your heart racing. And so a lot of times it's helpful to key in on those symptoms. And number one, sit down if that's happening. Stop what you're doing, get in a safe place, sit down. If you're driving, try to promptly get off the road, get to a safe place. If you don't get better quickly sitting, or if you're already sitting down, lay on your left side. That will usually bring blood to the brain. That's going to help with circulation. And then you can go back and regroup and decide if you need to eat something, or we can talk about prevention. But go ahead and sit down and then lay on your left side. Things that can be done to prevent this are staying well hydrated, making sure that if you're on your feet for a long period of time, consider wearing a belly band or an abdominal support band. If you're in a chair for long periods of time, just be mindful that when you stand up, it's a very common time for it to happen. Flex your legs, flex your feet, kind of keep that circulation going in your lower extremities. Sometimes an electrolyte drink or solution, and even in some cases, a salty snack, if you're going to have to be in one position, standing or sitting for a long period of time. And I think really the main thing is just being aware. Know that this is very common, and just being mindful of those early symptoms. And so sit down if you're standing, and then get on your left side, and then use your cell phone or call for some help. And it's really not a willpower issue. You just gotta heed those warnings, and then we can regroup and talk about prevention. Hopefully this is helpful. All the best to you.